Welcome back to Air Quality Matters and One Take. One Take, my take on a paper or report on air quality, ventilation and the built environment. One Take in that it's, in one take and tries to summarise for you a scientific perspective on something interesting in, usually 10 minutes or less, because who has the time to read all these amazing documents, right? This week, we're looking at a really important policy commentary that was recently published in the Journal of Health Security titled Federal and State Policy Opportunities to Improve Indoor Air Quality. It's authored actually by several previous guests of this podcast, including Georgia Lagoudas and a fantastic group of experts from Brown University, Harvard, and more besides. Now, we spend a lot of time on the podcast, as you know, talking about engineering and the science and the hardware of ventilation. But none of that matters if we don't have the regulatory frameworks and political will to actually get it installed and maintained in our buildings. And that is exactly what this paper tackles. It points out a glaring truth. As we say over and over again, we spend about 90% of our time indoors. Yet, we have major public initiatives that have given us clean drinking water and stopped indoor smoking and drastically improved fire safety, but we've completely missed the boat on creating a similar unified initiative for clean indoor air. You might think, we have the Clean Air Act and the EPA regulating outdoor air. Isn't that enough? The authors clearly explain why not. Outdoor regulations completely fail to account for the fact that outdoor pollutants just make their way inside where we spend all of our time anyway, and they ignore the fact that indoor spaces have their own unique pollutant sources. In fact, concentrations of certain pollutants could be 2 to 5 times higher than outdoors anyway. Furthermore, outdoor regulations do absolutely nothing to address one of the biggest indoor threats, the spread of respiratory pathogens like COVID-19, influenza, and others. The cost of ignoring this is astronomical. The authors note that the US economy could see a gain of $23 billion annually just from the 35% decrease in sick leave that would come from improved air quality. Clean air boosts cognitive performance, lowers asthma rates, and directly improves the bottom line of business performance. It is even a national security issue, as poor air quality in military installations and residences compromise force readiness and the health of our military personnel. So, what's the current state of play? Well, in the US anyway, it's a bit of a mess. The federal government really doesn't regulate indoor air outside of occupational settings, leaving jurisdiction largely to state and local governments. Because building codes are adopted and enforced locally, we end up with a massive patchwork of different standards across the country. Some states, like California, Connecticut, and Minnesota, have taken steps to create guidelines, especially for schools, but there is no comprehensive national roadmap. We have seen some recent progress, like the CDC releasing guidance aiming for 5 air changes per hour and ASHRAE launching its groundbreaking standard 241 for controlling infectious aerosols, but these are just pieces of the puzzle. To fix this, the authors have put together a really comprehensive menu of policy options, breaking them down into 4 main categories. The first recommendation, and arguably the most important, is that we need to develop health-based indoor air quality targets. Right now, building owners, facility managers, and the general public don't have a simple, unified goal to drive towards. The authors argue that we need clear thresholds or metrics for easy-to-measure indicators like carbon dioxide and PM2.5. They suggest that the EPA or a coalition of non-governmental organisations should publish these voluntary health-based targets, providing a clear benchmark that states and local entities can adopt. If you don't know what the target is, you can't hit it. The second big bucket of recommendations focuses on supporting states and local communities to actually adopt building standards and, crucially, figure out how to finance them. The authors propose developing a national model indoor air quality code. Think of it like the national model energy codes we already have. The Department of Energy could help facilitate this to provide clear consensus on design and operational standards. But they don't just stop at writing codes. They know that this requires investment. they recommend that Congress and state legislators provide tax incentives to commercial buildings that make indoor air quality improvements similar to the tax deductions that already exist for energy efficient buildings or LEED certified properties. They also suggest creating a state playbook filled with template language for regulations and building codes to make it as easy as possible for local governments to take action. The third area they focus on is implementing sector-specific standards. We can't treat a primary school the same way we treat a public bus or a military barracks. For schools, state health and education departments need to require and incentivise indoor air quality monitors, regular HVAC inspections, and better filtration. For nursing homes, which are incredibly vulnerable to infectious disease, the Centres for Medicare and Medicaid Services could set up and make indoor air quality standards a strict condition of participation, just like they do for hospitals. They also point the finger squarely at the government's own building portfolio. The General Services Administration oversees buildings housing around 1 million federal employees. While federal regulations require these buildings to meet ASHRAE ventilation standards, a recent audit showed that the majority either did not meet the standards or couldn't even be assessed. Why? Because building performance declines over time if systems aren't maintained. The authors recommend establishing a robust ventilation verification program to ensure these buildings actually perform the way they were designed to. They also call on OSHA to update its permissible exposure limits for occupational settings, noting that OSHA itself recognises its own limits are outdated. With many developed back in the 1970s, nearly half a century ago. The fourth and final recommendation is all about expanding research and development. We still have massive knowledge gaps. The authors suggest the Department of Health and Human Services should establish a national centre dedicated to preventing airborne disease to lead the federal government's research efforts. And here is the part I found particularly insightful. The authors call for the EPA and the FDA and the National Institute of Standards and Technology to create a proper testing and certification protocol for air purifiers and air quality monitors. Right now, the market is the Wild West. There is no federal certification guaranteeing that non-medical air purifiers actually work safely. Some air cleaners that claim to remove volatile organic compounds might actually increase them. And some technologies, like certain bipolar ionization devices, can generate harmful byproducts like ozone. We desperately need credible federal oversight to ensure that when a school or a business buys an air cleaner, it is actually cleaning the air and not making it more toxic. So what are the broader implications here? Why is this commentary so significant? For years, the scientific and engineering communities have known how to clean indoor air. We have the filters, we have the fans, we have the sensors. The bottleneck is not technology, it is policy. By laying out this comprehensive roadmap, Lagoudas and her co-authors are giving lawmakers a literal menu of options to pull from. They also correctly identify that we don't have to do all of this at once. They specifically emphasize that the two biggest priorities, the ones that will unlock the most progress, are developing those health-based indoor air quality targets and getting states to adopt indoor air quality building standards. If we can agree on what good air looks like and put it into the building code, the market will innovate to meet those demands. They also tie indoor air quality to the ongoing push for building energy efficiency. Building tune-ups can achieve up to 15% in energy savings while simultaneously improving air quality. We shouldn't be treating energy efficiency and indoor air quality as competing interests. They are two sides of the same coin, and policy needs to reflect that by incentivizing both together. Now, the authors do acknowledge the reality of the situation. Achieving these policy shifts will require new legislative vehicles, new funding, and new regulatory authorities. That is never an easy or fast process. It is going to require immense collaboration between non-governmental organisation, industry, academia and advocates to make the case to policymakers that this is worth their time and money. But I'll leave you with one final thought. The way we manage our indoor air is fundamentally a choice. We decided a long time ago that it was unacceptable to pump raw sewage into drinking water. And we decided it was unacceptable to let people smoke in restaurants and offices. This paper makes a compelling, undeniable case that it is time we decided it was unacceptable to breathe dirty, unventilated air in our schools, our workplaces, and our care facilities. Clean indoor air isn't a luxury, it's a fundamental requirement for a healthy society. Thanks as always for listening to this week's One Take. I hope you enjoyed it. These podcasts are not possible without our sponsors, Safe Traces and Imbiot, so thanks a million to them. We'll see you again next week.